waive. That is the call to waive IP rights in the COVID vaccines and COVID treatments. This is something that has been talked about in the news for many, many months now. I was surprised to learn that all the way back in March and April of 2020, folks were raising this issue, and it really came to a head in May when the Biden administration announced that it would support this call to waive IP rights in the COVID vaccines. I'd like to turn to my panelists now to introduce themselves, starting with Peter Pitts.
Thanks, Brian. Good afternoon, all. My name is Peter Pitts. I'm the president of a small NGO called the Center for Medicine in the Public Interest. I'm also a visiting professor of medicine at the University of Paris, and I'm a former FDA Associate Commissioner, so I'm a former government official here to help.
Thanks very much. I'll turn now to Tom Pochet to introduce himself.
Good afternoon, everyone. My name is Tom Pochet. Recently, I was head of IP at Allergan until we were acquired by AbbVie. And during the course of that, involved in a lot of public policy discussions around intellectual property. And currently, I'm consulting as general counsel and head of IP for a couple of small startup companies.
Wonderful. Thanks, Tom. And last and certainly not least, thanks for joining us today. Kara Coburn, please introduce yourself to the group. I'm sorry, Kara, we can't hear you.
Okay, I'm Kara Coburn, and I'm Associate General Counsel at Genentech, which is a leading biotechnology company in the US. One of the roles I have there is being very involved in public policy, both nationally and internationally, and I'm pleased to be on the panel today.
Great. Thank you so much, everyone, for attending, especially our panelists, and to those in the audience. We do want this to be a discussion, and we have built in just a few minutes at the tail end of this presentation to ask some questions. So if you do have questions, throw them in the chat, and hopefully we'll have a little bit of time to answer those toward the end of the day. For anyone that's interested, we'll also be sending out a short one-page kind of takeaway sheet, things that you need to know if you didn't have the time to attend the full discussion today, or if you want to pass on some info to your colleagues. We'll be sending that out to folks who are interested. So I'll put my email address in the chat box, and if you are interested in receiving that, please go ahead and let me know. The last thing I want to mention before we get into the meat of things is that my colleagues in our Dusseldorf office at Mayor Brown, Christoph Kruzen and Max Kuking, have put together a legal update about this same topic. And we'll be circulating that update to all of you that have participated today as well. So shout out to them, and thanks very much for being part of the discussion. Excuse me. So Kara, I'd like to start with you. What were your initial reactions when you heard about the Biden administration's decision to back this call by the World Trade Organization, or the WTO, to waive IP rights in the COVID treatments and COVID vaccines? What were your reactions to that initially?
Yes, I was very surprised and very disappointed. It's a reversal of decades of US policy, and I continue to feel that an IP waiver is not going to address the grave COVID crisis.
And when we talk about an IP waiver, and Peter, maybe you could help us out with this, what are we actually focused on? Are we talking about just patents, other forms of intellectual property? Help us out here.
Yeah, that's really important, because clarity is important, and also understanding what you're talking about is important. You know, my initial takeaway from the administration's comment was nobody on the Biden team seems to know what they're talking about. It's disappointing. You know, and it's not even a waiver, it's a temporary waiver, which means I'm going to tell you a secret, and then you have to forget about it later. You know, which is kind of naive. I guess the good news is that, you know, the WTO functions as a consensus organization, and there ain't going to be consensus on this issue. So it's a bit of a tempest in a teapot. But I think it does point out that the Biden team doesn't really have a handle on what you know, waiving intellectual property rights means. It doesn't really understand, you know, how vaccines are manufactured or distributed. There's no magic bullet to snapping your fingers and having the world have access to vaccines. A patent waiver does not build facilities. A patent waiver does not test quality. A patent waiver does not create logistical opportunities. All it does is muck up the system and scare companies away from investing, hundreds of millions and billions of dollars into innovative medicines, which is what's gotten out of this mess in the first place.
And so, Tom, Kara and Peter both used the word disappointed to describe their initial reactions. Do you share that view? And if so,
Well, certainly disappointed, but certainly not surprised either. I think we are living through at least a decade, if not more, of essentially a very political war on what the pharmaceutical industry does, some misrepresentations about what the pharmaceutical industry impacts public welfare. So, and that's really how I processed this entire IP waiver, that it had almost nothing to do with actually helping people, but it was really more a political shot across the bow of the pharmaceutical industry, maintaining that pressure that shows up when it comes to margin rights or reference pricing or reimportation. And this IP waiver is just part of that war. And whether it would actually work or not, and frankly, I think it won't, and I don't think anyone really thinks it will, it's really a political gesture and not actually a practical proposal.
I think that's a key point. I mean, when you look at margin rights, there was some news yesterday about margin rights. People were calling for remdesivir, for example, to be marched in on, and members of Congress from the Democratic caucus demanded a CBO study to get it done as quickly as possible. And the CBO did an excellent study, and it said that there was no innovation created by the government, and the margin rights were not appropriate. It's one thing to be disappointed in what government agencies find, but when you don't like what they find, you simply can't say we're changing the rules. Innovation can't be put at risk here. It's the most important thing, and it really has got to supersede at every level, political machinations.
Just to close out on margin rights, apparently in the Biden administration's 30-page executive order that just came out is an instruction to the Secretary of Commerce not to finalize a position on margin rights. And the expectation was that the finalized position would support the Bayh-Dole Act and essentially say that we're not going to get margin rights anytime the government finds it politically expedient. And so, again, this is all a piece of taking shots at an industry that is politically out of favor. I mean, when you have Xavier Becerra sitting in the administration, it's very hard to go in and feel like the rational arguments about how the pharmaceutical industry contributes to public welfare, those arguments are just not going to be given a fair hearing.
And I think, the key point is, I think we have got to call it like it is. We have people at the very top of HHS and the very top of the White House, who are politically very savvy relative to health talking points, but not so much relative to what health policy actually means and the implications of bad decisions.
And so all of this that I'm hearing, and we've got a question in the chat about domestic pressure, diplomatic pressure. Kara, what's the real goal here, do you think? I know we're asking ourselves to put ourselves in the head of someone else in the administration. What do you think is the real purpose behind this?
Well, yeah. I would not like to put myself in the head of somebody in the administration. I think that there is a lot of very justified concern about vaccinating the world and getting doses into arms around the world. And unfortunately, I think IP is a bit of a paper tiger. While I think there's no good evidence that IP or patents has been an obstacle to effective vaccination, that is sort of an expedient target, and thus we see the action that we have seen from the Biden administration. And I do think it's important. You asked earlier what is covered by the waiver, the proposed waiver. So the waiver proposed by India and South Africa covers patents, but also trade secrets, undisclosed information, regulatory test data, copyrights, and industrial designs. The scope of the proposed waiver in India and South Africa is extremely broad in scope. It covers health products, so vaccines, as well as medicines, diagnostics, medical devices. The Biden administration, so Ambassador Tai expressed support for waiving vaccine IP. The US does not currently have a proposal on the table in the discussion. So there's sort of a lot of moving parts. Patents is often what you see in the narrative, but a really significant component, which Peter mentioned, is actually trade secrets. And this is often articulated as sort of that secret sauce or know-how that is important for actually manufacturing vaccines and complex biologics.
Brian, H.L. Mencken said that for every complex problem, there's a simple solution that's wrong. And, a lot of times people are saying, well, the problem must be the pharmaceutical industry because they're so greedy and evil. And, as identified by patents, patents are bad. We shouldn't have patents. Bernie Sanders doesn't believe in patents. He believes we should have a prize system. So, a lot of this is just kind of repeating, this drumbeat of bad industry, bad patents, get rid of patents. And this is just an example. This is just an opportunity to verbalize that. And all it does is show how ignorant they are. It's unfortunate. It's like standing up in front of the class and sounding like an idiot.
I love the analogies. I love the quotes. And Peter, the big question I have, I think, is this going to help? Let's say that this was a well-intentioned effort to increase access, to increase distribution of the vaccines. Let's say that Tom's wrong. Sorry, Tom, that this wasn't a shot across the bow of the pharmaceutical industry, right?
Well,
Is this going to help at all? And if so, how?
Well, first, let me say that Tom is completely right. So let's take that off the table. But I think the fact is that waiving patents either permanently or temporarily is not going to put one needle in one arm 1 minute sooner. We can't even get existing volume of vaccines that we have to other countries. You have to build factories. That happens in years, not days or months. Remdesivir, Gilead has waived the patent to the predominant number of underdeveloped countries. The WHO has a list of essential drugs, and I would say 99.9% of all those drugs are off patent right now, and they're still not available in the developing world. So it ain't patents here, folks. It's something else. It's infrastructure. It's corruption. It's a whole variety of things that we're simply not looking at. Solving this problem is hard. Pointing to patents saying that's the problem is just a simplistic solution, and it's not right, and it's dangerous.
Well, I would say first you have to decide what problem you're trying to solve, and then reason back from that. If the problem you're trying to solve is poverty and lack of access to healthcare, particularly crisis oriented healthcare, the answer seemed obvious to me months ago that the PEPFAR program with AIDS drugs to Africa really is the model, right? It doesn't destroy the innovation ecosystem. It's basically a way of saying wealthy countries can deploy their resources to get quality medicines to countries that can't afford it out of a humanitarian concern for them. And you see us edging in that direction, right? I mean, the G7 countries have committed a certain number, I think it's a couple 100 million vaccine doses to that end. The problem with that solution is that it's elegant, right? It actually solves the problem. It doesn't destroy anything or achieve any political ends, and we could move on from it. And so that's why I kind of revert to my cynicism that this is really less to do about solving a world health problem. And let's be sure, we have an empirical experiment going on right now about a patent waiver. Moderna has said that they're going to waive patent enforcement during the pandemic. Nobody's making a knockoff of the Moderna vaccine, right? There's our experiment in real time. Patents are not the obstacle. People haven't even started. So, and again, to Kara's point, the actual waiver requested is vastly broader than patents, right? It includes trade secrets. It includes all that extremely valuable information that's in your CMC filing with FDA, which I don't think most people really have grappled with. You know, what does it mean if you're a technology company and now all of your secret sauce for a complex product is going to be shipped off to the rest of the world? You know, that if I was Moderna, I'd be in a wild panic.
But I think, I can't state strongly enough that, when you go to Geneva for any period of time, there are hangers-on at WHO and WTO whose full-time job is to pick away at patents and intellectual property. And this is just the latest opportunity for them to do that. And they have friends now in high places within the Biden administration. And I hope that the president and his team recognize that by going down that pathway, they're going to do tremendous harm, not just to the American healthcare system, but to the global healthcare ecosystem that Tom was talking about.
And so if patents aren't the obstacle, what is? And can you help us understand that? What's keeping us from getting every shot in every arm that wants one?
So why is the US and the UK not having this problem? And one of the answers is both nations decided, very creatively to buy vaccines at risk. And as it turned out, we made the right move. It easily could have fallen on its face. We look very smart now. We could have looked very stupid if it had gone in the other direction. Other countries chose not to do that. Countries that pay for vaccines upfront by contract get them first. And other countries in Europe, Taiwan, Singapore, developed countries in other parts of the world simply chose not to do that.
What about the developing world? What about some of these countries that may have the manufacturing capabilities for this, but not necessarily the know-how? Is there a way to address those concerns that the WTO is?
The thing is, they have neither the know-how nor the facilities. You're making an mRNA vaccine, making any vaccine, is far more complicated than pressing generic pills. And there's a problem with that too, relative to quality and counterfeiting. It's a complete lack of understanding about how vaccines are manufactured that makes this announcement just so astoundingly obtuse.
And so, Kara, as someone working in Genentech who presumably has knowledge of how vaccines are made and how they work, is there an approach that would help achieve the real goal here, or at least the stated goal of more access, more distribution?
Yeah, so I mean, just to be clear, we don't have a vaccine business, but I think it would be instructive to read a little segment from a declaration from members of the world's biotechnology sector on global access to COVID vaccines and treatments. So this is a short letter that was put out about 2 weeks ago and signed by hundreds of CEOs from, including ours, full disclosure, from within the US, as well as internationally, as well as industry associations. And they point to strong collaborative global efforts like those endorsed by the G20. Successful require national governments to address legislative or contractual impediments to supplying populations in need, especially in low and middle income countries. So I think this would include things like tariffs and export controls, regulations related to approval of medicines. There's a lot of bottlenecks in the global system. And they go on to say that bottlenecks and shortages in global supply chains for vaccine production needs to be urgently addressed. And as Tom mentioned, strained healthcare systems in low and middle income countries need significant support to ensure that vaccines get to people. So this is the last mile problem. I know that global industry has pledged to work on increasing production as much as possible. So this is an ongoing effort, and an independent study has modeled that there will be 1 billion doses of COVID vaccine available by the end of the year, which is pretty astonishing progress when you look back at where we were in January or even in May, when the U.S. endorsed the TRIPS waiver for vaccines. And I think the final point made by the global groups is, we need to keep innovating. This COVID isn't over yet. There's new variants coming, and we need to preserve the incentives for innovation so that when the next pandemic comes, we're as prepared as we were for this one.
There's good news here too. In many developing countries, what they do very well from a public health perspective is vaccinate people. Large scale national vaccination efforts in places like Egypt, for example, are hugely successful. So, once we can get a supply of vaccine to these countries, they can get the job done. They'll do a better job quicker than we did here in the U.S., where we stumbled out of the gate relative to logistics. I think, but at the end of the day, to Kara's point, volume is not going to reach these countries by disincentivizing Pfizer, Moderna, AstraZeneca, Johnson & Johnson, et cetera, from manufacturing vaccines. You have to allow the people that are making these things to continue to make them. One of the beauties of mRNA is that you can make it faster than traditional vaccines. So we've got to give ourselves a pat on the back and recognize the victory of, in this case, Western technologies and pharmaceutical companies to really develop, manufacture, and get into distribution, hundreds of millions of these vaccines.
I think Peter's point is really important. I mean, we have to remember that it's more than a bit. It's a technical marvel that we have so many vaccines at this point in time. And yet the policy response as embodied in this IP waiver is not to celebrate that and say innovation brings us miracles in remarkably short timeframes. It's to create a new form of risk in drug development, right? We have scientific risk, we have safety risk, we have IP risk. I mean, depending on, all these types of risks. And now we have government risk. If you're working on a drug in a therapeutic space that is at the crux of a public policy crisis, the support that's being given to IP waivers right now tells you that you have to be worried that you can do everything right. You can get over those first 3 hurdles and the government may come in and take it. And I think the last thing we need is creating more risks that need to get discounted into the R&D pipeline. I mean, in the pharmaceutical side of the fence, return on investment, if you look at some of the studies that like Deloitte has put out, is single digit at best. It's like, how do you attract entrepreneurial risk capital when your return on investment is 3 to 5%, over a portfolio of drugs? That the small molecule space really cannot bear another form of risk. Biologics are a little further down, higher up on the return, yield curve, but as innovation proceeds, they'll descend to the cost of capital as well, and accelerating that is not going to help anybody.
Also, the reality is with remdesivir, that's waived its patents to almost the entire developing world. So those patents were waived, not patents. They were not going to be enforced by the company, and yet these countries have no remdesivir. Reality counts here.
Yeah, I wanted to add that over the last year, this is following up on Tom's point. There's been over 950 global R&D projects on COVID vaccines, treatments, and biologics, because companies have diverted efforts from other projects, to work really hard to address this unprecedented global emergency. 70% of these projects are from small and medium-sized companies. So just underscoring that first the industry was sort of able to rapidly adapt and bring resources to bear on the COVID crisis because of all that sort of IP permitted having these sort of existing capabilities to shift to focus on that type of projects. But I think looking forward, I wonder what the risk of a waiver will do the next time around, especially for a smaller or medium-sized company where, if you're looking at shifting investor dollars to work on a new global emergency with this added risk of a waiver, I feel concerned about what that might mean in the future.
Well, I'm concerned about that too, actually. And
just one thing on
Peter,
Kara's
go ahead, please.
a key point to what Kara said, and Tom as well, is the majority of these projects fail. We hear about the ones that succeed. We don't hear so much about the ones that fail. I think 80% of all programs, probably higher, fail. And that's money out of the pocket of these companies that impacts investors, that impacts people that own the stock. This is an at-risk proposition here, that whether it's the WTO or the WHO or any other non-commercial entity, they don't accept risk. Risk isn't part of their problem. But that's not where the successes come from. You don't have the small successes that we hear all about unless you have the foundation of the majority of these programs failing, and you have to recognize that.
And that's a big deal, Peter. It is. And so I'm curious to know from you folks, are there going to be any long-term consequences of this, even if these waivers don't end up materializing in any tangible way? The mere fact that everyone's talking about it, that the US has pledged its support, that other WTO members have pledged their support. Is this a concern for folks in the industry? And do you foresee any changes happening as a result of this?
Well, I suspect that lobbying organizations will get off their duff and lobby and explain to those in power the very dangerous consequences of their actions,
Such as
having investment stop flowing to pharmaceutical companies, which means we don't get a lot of innovation, which means people don't get better quicker, which means healthcare costs go up. This is not rocket science.
I mean, I think, again, I just process this as part of a long war, and it's been going on, Republicans and Democrats. I mean, it's hardly the case that the Trump administration was any fan of the pharmaceutical industry, right? They're perfectly happy to consider things like reimportation and reference pricing. Certainly plenty of Republican senators were willing to dig on IP reform and how many patents you could list in the Orange Book or a Purple Book once that becomes a real thing. The pressure is just going to be maintained. And, I think the exercise for those of us who are in the industry, I mean, Frank, I wake up in the morning, I'm really glad to work in this industry. I'm glad I'm not making YouTube cat videos. I'm proud of the products that we brought to the market and made people's lives better. It's just we have to be eternally vigilant. We have to get to the people on the Hill that are concerned about it, whether it's Senator Tillis or Senator Coons in the Senate. Because just as the pressure is bipartisan, the people who understand the issue, it's also bipartisan. And if I could encourage people on the call, it's really the place where I'm a little disappointed is that early stage companies do not show up on the Hill and explain their life cycle. Whether it's through pharma or big companies, we find our way to the Hill and make our case. But I have sat there and argued with people in a startup environment pre-IPO companies and said, look, you need to pay attention to your ecosystem. You're the people, if I walk into somebody's office, as head of IP from Allergan, that's not as persuasive as somebody who's at a, platform technology company that's taking a new approach to oncology, saying this is life or death for my company. Allergan will survive, and AbbVie and Genentech and Roche, and we'll all survive in one form or another. We may not be as healthy as we could have been, but it's the small companies that I think really need to get in there and get to their Congress people and explain that these things really do dry up investment dollars, which means that, your pipeline is only going to be maybe one product instead of three, or maybe it's going to be none because you can't attract funding at all.
Yep.
That's really where, as an industry, we need to step up.
Yeah, and part of the problem with legislators is they don't like complicated answers they want simple answers to complex questions. Tom mentioned drug importation twice. President Biden has given the nod to thinking that's a good idea. The Canadians have said they're not interested. Because a country of 30 plus million people cannot supply the drugs to a country of 320 plus million people. Canadians made it very clear that if this becomes government policy in the US, they're just going to shut it down 100%. Why don't people remember it? There's selective amnesia here. If I were Justin Trudeau, I'd be banging my head against the wall thinking, I thought once Trump was gone, some sanity would be returned here. But it's the same silly nonsense emanating out of the White House. Why is this happening? And the answer is it resonates politically.
You touch on something, Peter, I was going to say for later, but I think it makes sense to ask it now. I'd like to go down the line and just say, if you all had 30 seconds to walk into President Biden's office, you've got his ear for those 30 seconds. What would you tell him about this issue? And I'm going to go backwards here. Kara, we'll start with you and work our way back to Peter, I think.
Yeah, I think I would tell him that innovation matters, and that that intellectual property is the foundation of our sector. So, I think looking forward, again, COVID isn't over yet. We're still fighting variants. We're still trying to get doses in the arm all around the world. And I think the industry is committed to continuing to innovate and bringing it back to IP. IP is the core of what permits us to innovate. And I think that is what I would explain to him. And also, and I know this would be a thrilling topic, but I would love to explain the complexities of biologics manufacturing.
Did you do that in just 30 seconds?
Can I do that in 30 seconds? Biologics, if you compare a biologic to like a small molecule drug like aspirin, it's like comparing a bicycle to like a jumbo jet, both size-wise, but in terms of complexity and multiple complicated components coming together that just have to be assembled with exact precision in that way. I think it's a series of very complex processes that need to operate with a high level of precision and are very individuated to different molecules. And it all needs to work just right to get a safe and efficacious product.
Fantastic, thank you. Even me as a mechanical engineer could understand that, so very well explained. Tom, what are your thoughts? If you had Biden's ear for 30 seconds, what would you tell him?
I would go straight for the cynicism. I would not try to explain to him that he'd be destroying a remarkably sophisticated ecosystem. And I would say, you want a political win? Adopt a program like PEPFAR and supply the world with vaccines, and you'll look like a king. You'll get a Nobel Prize for helping out the world, and you'll actually will accomplish something good.
Okay, so we've got a good cop approach, and Kara, I won't call you the bad cop, but maybe a neutral cop approach. Peter, what do you have to say? Take us home.
Well, I think what I would suggest to the president is that he appoint a innovation czar, with members from across his administration, career public health officials, academics, people in business, more Tony Fauci's and less my pillow. I think when you allow political operatives, political appointees to drive the system, you get political solutions to problems that are not inherently political. Let the professionals do their job, but make it a priority. Put together a blue ribbon commission, put together, name an innovation czar, and make it happen. Create a blueprint and a pathway.
Outstanding. Thanks very much. I do have one last question that I'd like you all to address, and then we can turn to some of the questions from our participants here. The G7 summit that happened last month. I think, Tom, maybe it was you that brought this up. This decision to donate millions of millions of doses of vaccines
Hundreds,
to those countries that need them. How might this affect the need? Go ahead.
hundreds of millions.
Hundreds of millions, forgive me. Quite a substantial amount by any measure. Doesn't this solve the problem? Doesn't this supersede the need to waive IP rights in some sense?
You would think, although it's interesting, like the day before going into that G7 meeting, it was clearly something that was in flux. President Macron, or I'm probably mispronouncing it, from France was clearly leaning towards an IP waiver solution. And I think somewhere in there, somebody said, look, this is something we can do that's practical, will actually help people, and that we can all agree on. Because I think they got in there and there was no way they were going to come out with a unified response. And what I would hope is that they realize that that actually is the best answer and not view it as just a waypoint along the way while they're still trying to work out an IP waiver. Because the reality is that you still have to figure out the distribution system, right? These are not drugs that you lyophilize and let sit on a shelf for 6 months. I think it's a really good first step. I think there probably needs to be a little bit more thought around turning that announcement into a program. For example, just as we have in the United States, there's a vaccination priority system, right? Old people got it first. Kind of triaging where those doses need to go and really looking at whether, how many doses do we need to make available to get to that, threshold level of where the most at-risk people are covered. So it's a great first step. I hope that that will be the direction that dominates from here on in on this issue, because I think it's the right way to approach it. But the IP waiver aspect of this, I think, is going to drop off domestically as other domestic policy issues that have nothing to do with this become important, like inflation. Again, going back to my cynical view that this was political from day one and it'll be political at the end. So I suspect that for the specifics as to the IP waiver, it's essentially going to die out, at least domestically in the United States. But the long war is going to go on and on.
Yeah, I think at the end of the day, the patent waiver conversation lets the West off the hook. Oh, we'll waive patents and magically things will take care of themselves. Not true. The reality is, to Tom's point, we have to tell the companies to make the vaccines, and we, wealthy countries, have to pay for them and then ship them to the places that need them. That's what's going to get the job done. That's kind of what came out of the G7. But that means we actually have to write the check. And I'm not sure whether a lot of these countries are willing or ready to do that. They'd much rather say, oh, we'll waive the patents and things will magically take care of themselves.
Excellent. Well, thank you all. I want to address some of the questions we got from our attendees here, starting with Jonathan Kimball. And I'm sorry, Jonathan, if I'm mispronouncing your name. Jonathan asked, would the panelists support compulsory licenses, assuming a local company could produce the vaccine, if the country wasn't getting adequate supplies of the vaccine? Or does the country just need to wait until they obtain the needed volume?
Well, I mean, beyond it being a TRIPS 2 technical question, the proof is in the pudding. Remdesivir is available right now to be made anywhere in the world, and it's not. Next question.
That was
I
pretty
mean, I
easy.
really think, a company like Pfizer or Moderna is in the best position to identify manufacturing partners that have the capability to make, or J&J or whomever. And I think they have been looking for excess manufacturing capacity. So I would really, in general, I don't support compulsory licensing. But I think the parties that are making the drug now are in the best position to expand manufacturing capacity throughout the world.
Sure. Also, with mRNA technologies, there is no excess capacity because there is no capacity. It's like there's no excess capacity in building rockets that go to the moon. It simply doesn't exist. There is the capacity that exists is being turned on right now at full tilt.
This wasn't specifically part of the question, but what about licensing this technology on FRAN terms, fair, reasonable, and non-discriminatory terms?
Well, and where are they going to make it? It's like buying a really expensive cookbook, and all you have in your kitchen is a single burner. It does not get the job done. Period. We've got to stop talking about that. This is not a hypothetical problem. This is a real problem that needs to be solved in real world terms. And the way to get that done is to make sure that the factories that are turning these projects out, whether they're vaccines or therapeutics or diagnostics or ventilators, operate at 150% capacity.
Kara,
You're
muted again.
Sorry, I think another factor with biologics and vaccines is that compulsory licensing a patent doesn't get you the sort of know-how that is needed to successfully manufacture a biologic or a vaccine. And I agree with Tom that I think voluntary partnerships are always the preference when you're working full tilt to scale up manufacturing. You want to be working with a trusted partner because it's actually an enormous resource investment to transfer technology and get it up to speed.
Another problem too that we haven't really talked about is you can't allow subpar quality products to get on the market. All of these products are extremely complicated to make. The quality control issues are complicated and profound, and that can't be understated.
Thank you all. Another question we got from Jane Lambert is, do you think the U.S. Trade Representative's announcement in May was motivated by domestic pressure or diplomatic pressure? I think we've danced around this question a little bit, but do you think it was mostly coming from within or without the United States?
Oh, I'm sorry, what we're dancing around. Let me be blunt. Domestic, period.
Domestic.
And our Genentech judge, what do you think, Kara?
I think it's a mix.
Outstanding. Well, if folks have any other questions that are attending, please put them in the chat. We'll do our best to answer them. Otherwise, I'd like to go around and ask folks one final question, and that is if you had one takeaway, one thing you wish that more people, the common folks, folks like me, would know about this particular issue. One takeaway, what would it be? And Tom, I'd like to start with you.
Oh my God. So this is, I wish everybody understood what a Pareto optimal move was, right? When a drug company comes out with a new drug that cures a disease, the world is better, no matter what the price is. Because the day before that drug was announced, you didn't have something. And this idea that pharmaceutical companies somehow make the world worse off. It's like, no, everything we make makes people better. And then a decade and a half later, it becomes dirt cheap. So I really wish people could understand the life cycle of pharmaceutical development and how it is a relentless march to improving human welfare.
Thank you. Peter, what you got for us?
I guess there are two quick things. The first is, we're all applauding the fact that science is back. But that has to be a good thing, even when it doesn't necessarily, lead you to where you want to go. If science is back, you've got to follow science where it leads. And I think that somehow, when it's not politically expedient, people tend to forget that. And the second thing is, if you don't reward innovation, you don't get it. And there are two types of innovation. There's incremental innovation, which is the majority, and then there's discontinuous innovation, like mRNA COVID vaccines. We're lucky that that happened at this moment in time. But if you punish innovation, if you deter investment, you don't get innovation, and that's the worst outcome of all.
Thank you, Peter. Kara, send us home.
Just springing off of what Peter just said, I think something that has been really breathtaking to me is the rapid and incredible accomplishment of the mRNA vaccines. mRNA has been something that, I'm a former scientist. It's something that has been, plugged away at for a number of years. But the fact that, the COVID virus was sequenced and then just 10, 11 months later, we have a highly efficacious set of vaccines is simply breathtaking. So just bringing that back to Peter's comments on, incentivizing innovation, but also appreciating what was brought to the world through the effort of the companies, but also, of course, scientific inquiry over many years.
Great. Well, thank you so much, Kara, Tom, and Peter, for joining us today. Everyone who's attending, thank you for joining as well. I just put my email address in the chat box. If you'd like more information about this, if you'd like to be part of the discussion, please let me know. I see Kara's done the same thing. If you would like that one-page takeaway sheet that we talked about, please email me as well. I'll be happy to share it with you. And thanks for putting up with our minor technical difficulties in the beginning. Appreciate everyone participating here. Thank you all and have a wonderful, wonderful week.
Thank you, Brian.
Thanks a lot.
Bye.